Rheumatic diseases and musculoskeletal disorders affect more than 40% of the European population, causing significant disability, pain, reduced life expectancy and a very high economic burden of around €240 billion per year. The available therapies focus on addressing the symptoms, often accompanied by severe side effects. Currently, the disease is considered incurable. To date, the exact causes of these diseases are also largely unknown. It is suggested that two factors are important for the onset of a rheumatic disease. One is an imbalance in the gut microbiome caused by a high number of bacteria that produce harmful compounds. The second is an increased permeability of the intestine. This way, these bacterial compounds are translocated into the blood and circulate throughout the body. This leads to local inflammation, for example in joints, and can manifest as chronic rheumatic disease. Together with 14 partners from 8 European countries, the ENDOTARGET project is investigating mechanisms and triggers for the onset of rheumatic diseases. The project aims to investigate the importance of the gut microbiome as a driver of chronic systemic inflammation and its role in the pathogenesis of rheumatic diseases. It explores the transition from health to disease in rheumatic diseases through cohort studies, biomarker analyses, clinical investigations, mechanism analysis, interventions and software development. The objectives include the development of personalised therapies and diagnostics, research into new medicines, the use of digital prediction tools, the implementation of nutritional interventions, and the identification of risk parameters. For patients, our digital and personalised diagnostic approaches for rheumatic diseases leading to early detection and tailored therapy to minimise the risk of chronic disease development. We will produce actionable recommendations to tackle rheumatic diseases, which will reduce the risk of rheumatic disease onset as well as the associated disease-adjusted life years. This will result in a decrease of healthcare costs for rheumatic diseases and simultaneously the possibility to allocate saved healthcare costs efficiently. Clinicians will be able to use an AI-based tool to predict rheumatic diseases and select therapy to provide personalised treatments. For citizens, our project means increased awareness of rheumatic diseases and better self-management to reduce lifestyle risks for chronic disease onset and improve quality of life. Learn more about ENDOTARGET and visit our website.